Welcome, welcome, welcome. It's 3 o'clock Pacific Standard Time and I am going live. I am live on Instagram. Hi, Yvonne. So I am waiting for my friend, Dr. Karin Harp, to join us. I just saw her, so we're just going to wait a couple of seconds for her to join. And hi, Jasmine. And of course, like clockwork, my dog is in the background here and would like to go out right now. So I am waiting for Dr. Harp to connect. Hey there. Hi.
Hi there.
How are you?
I'm fantastic. Thank you.
How are you doing?
How's my sound? You can hear me?
Yes,
I can.
you're actually doing really good. I'm just waving to all the people who have just joined. Olympia, Crystal, Motoronosto, okay, Lulu Harp, and Stephanie Din. Very nice to meet you all, and thank you for joining our IG Live. I am live here with Dr. Karin Harp. She's a local dermatologist. She's a board-certified dermatologist. Why don't you give a little bit about yourself? I know I have a little bit about your bio, but you are my favorite dermatologist in this local area in Westlake Village.
Oh.
And so I brought her on today to talk about skincare because certainly I have some knowledge about skincare, but who better than to ask Dr. Karin Harp about skincare? She has full breadth of knowledge. She has a ton of experience, and she's been doing this a long time. So you were up in Washington. You completed your training in Washington, and you went to medical school there as well as your residency in dermatology. And you completed that in 2005. So how long were you up in Washington?
I was in Washington for quite a long time. I attended medical school at the University of Washington and did my residency in dermatology in Washington. And that was all based in Seattle. And then I was grateful to become the medical director of the Department of Dermatology at the Everett Clinic, which is a clinic just north of Seattle. And I was there for 7 years and before I moved myself to Los Angeles.
Yeah.
So it was I think I was there about 13 years. And I've been
Now,
in
how long
practice
have you been
for
in Los
15
Angeles?
as a dermatologist. So I've been in Los Angeles 8 years now, and we opened Apex Dermatology. We're about to celebrate our 6th anniversary. So in July this summer, it'll be 6 years owning my own practice as an independent private practitioner.
Wow. So has it really been that long, 6 years that I've known you? It's been a while, huh?
It has. I'm so grateful. And thank you for having me, by the way, Dr. Tansavatdi. I'm so happy to be here with
Yeah,
you. So thank
no
you.
problem. I just wanted to check one thing, my Wi-Fi, because I hope that I'm clear enough. Can you see on your end, is there any blurriness to the video screen?
For me, I don't see you as blurry, but there is some
There
delay.
is some
So
delay?
in hearing
Okay.
things, I feel like I have to pause a little bit longer.
Okay.
Mm-hmm.
Well, I think I'm going to check one thing just to make sure that hi, Dr. Folly. Hi to the joint. Sorry, I paused for just a second so that I can make sure that I'm on the fastest connection that I can be for you for purposes of delay. So there's no delay there. All right, so after I just did that, I just want to introduce myself. So my name is Dr. Kristina Tansavatdi, and I'm a facial plastic surgeon, board certified, and I'm in the Westlake Village area with Dr. Karin Harp. And my focus is just the face and neck. So I do both surgery and non-surgical procedures. Hi, Anita, and hi, I'm blanking out on her name, who just joined she, I think, is a nurse she may be in Seattle, but we met when we were in Alaska together. And hi, Dr. Wiggins. So nice to see you. All right, so let's start by, I guess, hitting it right off the ground on these questions, because there are some good questions that were posted by some of our viewers, and they wanted to know all things about skin. I mean, there's a common thread about what to do for your skin, particularly in this time. So I'm going to bring up, hi AC Bar, hi Christine. All right, so I'm going to pull up this question that came up from one of my patients. She wrote in, JC Girl, she wrote, what do you suggest for skin that is starting to show fine lines and some wrinkles? It's just that first start of aging that we're starting to notice. And this will apply to most people. Maybe you're not older and seeing more lines, but even when you were younger, you could have used this. So why don't we go over that? Because we could use it at any age.
Perfect. I think there are a few lifestyle basics that we obviously want to, carry out throughout our lives. So eating a balanced diet, exercising, hydrating well from the inside is a good start. Reducing stress, those things do help just the oxidative stress of the skin. One of the number one things dermatologists spend our time teaching about, especially when people start to really want to listen, is sunscreen and sun protection. So if we're starting to see fine lines and wrinkles, the studies show that 90% of the aging-related changes of the skin come from sun. So we really want to sun protect avidly, and that can mean physical sunblocks like titanium dioxide and zinc oxides. It could also mean a hat or standing under a tree or choosing to take a walk in a shady area. So sun protection is key. I think from the standpoint of how to manage your skin, so when we cleanse, we definitely want to cleanse twice a day. We want to use products that are not harsh, so things that don't dry out our skin, those actually exacerbate wrinkles and fine lines. And then we want to use products that reduce fine lines. So we'll probably get into this later in our conversation, but vitamin C's are really important for that. So we talk about that as your orange juice for the morning. So
I like that terminology.
Reduce fine wrinkling. Yeah, your orange juice in the morning. Yeah. Depending on someone's sleep structure in life, sometimes it's the vitamin C, so it's your orange juice in the morning, and it might be a woody plant in the evening for something called resveratrol. So that comes from grapevines. So some people drink those grapes and some people don't.
I take a pill.
But you could use you take a pill. There you go. So and that's totally appropriate. So resveratrol also reduces fine lines. So that's something to think about for the evening. And then hydration from the outside. So we want to use things like hyaluronic acids to moisturize and hydrate our skin. And part of that and what kind of moisture layers we're going to use really depends on our skin type. But I think thinking about appropriate cleansing, what are our potent antioxidants or stress relievers, and then what kind of moisturizers do we want to do? And that would be a very good start.
Well, so I am going to go back a little bit since you rattled the whole list of things. And brought up a great question because you were talking about washing your face twice a day. And I get this common question, how much do I wash? I don't usually wash my face. I'll have patients who don't wash their face and they'll just use one of those wipes. And then when I tell them to wash their face, and it's like, how often do I wash my face? Once a day, okay?
I think for people, we always have to take everything with a grain of salt, and we need to recognize that, there's certain processes that you can only ask for so much. So I think for people who aren't washing, I would ask them to start with once a day. I think that's a very appropriate goal. Going from 0 to 1 is not that hard. Going from 0 to 2 is harder. So I would say I would ask them to wash once a day. And then with those claws, I do find a lot of people are using them. And then, so there's things to think about in that. One is waste, right? So we're throwing an object away. We don't really have to do that. Secondly, it is leaving something on your skin. So when you're using that to wipe off, I recommend people splash afterwards. So do a nice splash and cleanse off whatever you just left on your face. Because if you look at the ingredient list, there are certain ones that are more gentle or have less chemical agents, fewer chemical agents. But it's nice not to leave that on your face if it's not something you were wanting to have there. So that's
So one of the things that you said was moisture. Say wash twice a day. You said washing your face. You also said vitamin C and sunscreen. And then you also said something about hyaluronic acid or something for moisture. So we're going to go through each one of these things. But before
I'm getting delay again, sorry.
But before we do, I guess I would like to address Christine's question here. Christine asks, besides sunscreen, vitamin C, and retinol, what else can we use for home remedy for our skin, especially now where we can't go out to see our estheticians.
Mm-hmm. So that brings up a great point so we have estheticians in our office at Apex Dermatology who are going to be doing video consults. So you can actually have a video consultation with a skincare expert while you're at home trying to figure these things out. And you can go to our website at apex-dermatology.com and find out how to request an appointment. And then we also have a skincare store, which is apex.dermatology.myshopify.com. So that's one way to go. But to think about yourself at home. So what else, you asked specifically, Christine, what else can I do? So as a home remedy, let me think about that. A home remedy. Part of it is digging through your drawers and cabinets and looking at what you have. And then thinking about non-expired items. So things that are expired more than 6 months, I would throw them away. Things that have been open more than 6 or 12 months, I would also throw them away. And the bottles have little jars on them that show a little open, and it says 6M or 12M. So if it says it's not good anymore, throw it away. Just because there's, we all have this opportunity to clean out our shelves right now. And then things that are not expired, and I would start looking at those, because as you know, we all have a bunch of stuff at home, right? So if you've already invested money in something, we definitely want to help you utilize that expense you've already had. And then look at those agents. So things with hyaluronic acid, so that's really nice and hydrating. Dimethicone is a smoother. Glycerin is nice and moisturizing. So part of it really depends on what you have at home. And sometimes you just need a hydrating, you could even make your own hydrating mask that way. You could say, okay, I'm going to find my best hydrator, get a good cleanse, get a good layer of that hydrator on, let it sit for 10 minutes, wash that off, and then do, whatever your next steps are. So I think it is a good time to be.
Yeah. Oh, just a little lag. A little lag. Okay, there. So I just wanted to say, I guess what I'm hearing from you is you're asking us to do Marie Kondo style, go through our drawers and try to organize everything, huh?
I don't think you need to organize it. I just think it's a good opportunity to either find something that's not so old and use it, know. It's funny what we have, know, if you think back, what was the last thing I bought? Oh, okay. Yeah. And use that. I don't have any home recipes from the kitchen. I can tell you that.
So this comes another question that I've gotten from clients before, and I'll pose it to you because people are interested in home regimens where they purchase over the counter somewhere. I won't say where, but these home regimens for skin peels at home, chemical peels. What do you say to that? What is safe? What's not safe?
Well, my challenge with the home chemical peels is there is not a lot of regulation as far as what you can sell online. And so my concern for people is I'm concerned about people buying things that damage their skin. We certainly have had a good number of patients who come in having burned themselves with home chemical peels. Either leaving them too long, not knowing what the agent was, using them repeatedly. So unfortunately, I see a lot of people who need our help from damage they've caused with that. And a lot of times what people are doing is causing a lot of inflammation. And then some skin types that can lead to like a browning of the skin. That's really not what you were going for. So, we really want people to be cautious about that. I think I would suggest sticking with lines that, that are tried and true and trusted and well-researched. If you're going to use, cleansing pads or glycolic peels or things like that. But if you start seeing numbers that are getting too high, percentage wise, you have to wonder, is this safe? Should I be using it? I think, glycolic pads at 10% for most people can be used. If you're going above 20% in a home use situation, that's not a good plan. So I think being careful about it is what I would say. Good
advice. So Dr. Harp, there's another question here. AC Bar just posted, is there a good at-home remedy to reduce the appearance of stretch marks? Oh boy, stretch marks. I know.
That's a good question. It is. It really is. The tough thing is the data is not very good on that. So stretch marks are a form of inflammatory thinned scarring. And so when they're bright pink, they're inflamed. And then when they turn white, they're really thin. And that's the skin's form of scarring there. And so, there are products that don't work. Like honestly, bio oil does not work. Mederma does not work. So I would not put money into those. There are silicone gels that are totally safe, just stay on the outside. They don't absorb into your body. So you could think about something like that. Agents that have silicone gel in them are useful. There aren't any known, kitchen remedies or anything like that that would actually work. And one question, sometimes people ask about
Yes, I
those
was
little
going to ask you
micro
about
needle
that.
rollers.
Yeah,
Yeah.
little needle
Yeah, so
micro
the challenge with
rolls.
those, yeah, so people do use them. We don't recommend them because of the increased risk of
Mhm.
staph infections. So the problem is, in a medical setting, when we have microneedles, we have a sterile tip for each person and then it's thrown away. If you're using the home type, you can grow bacteria
Certainly.
on that. So, if someone's already doing that and really wants to do it, they would have to spray it with
Yep.
alcohol,
Yeah.
sanitize their skin, do the little rollies, but we don't recommend it,
Yeah.
is what I would say, just
The
because of
other
the
thing
risk of
is also
infection.
those devices are not meant to be reused frequently, right? So some of them they've got
Correct.
heads that you can change out or just throw away completely. But the other thing is the depth of those
Mm-hmm.
needles don't go far enough to stimulate collagen because they're really meant just to be the surface because they're not FDA approved,
Exactly.
so they can't be so deep. And you really want to get deep enough
Exactly.
to stimulate the collagen. All right.
I think it's also hard on people, if I may add, just because collagen building
Yeah.
is slow. So we can have people overdoing it when they're not. It's important to recognize whatever you're doing to build collagen is very slow. So anything you do takes 3 months to build collagen. So you're layering those treatments, but you're going to, if we're doing them in a medical setting, we're going to layer them every 2 to 4 weeks. And really every 4 weeks is very appropriate. But it takes another 12 weeks past every treatment to see
Right.
what collagen you're building. So people need to
And
be
people
patient
can
with those things
become
too.
impatient. They're like, but I don't see anything, doctor. Yeah. All
Exactly.
right. So
Yep.
Christine asks, what does glycolic do to your skin? How often should we apply it?
So glycolic acid is very helpful to calm inflammation. It can clear some of the sebum from our pores. It has a really nice effect on acne and de-aging. So I think glycolic acids are lovely. At lower percentages, they're great for all skin types. So we can really treat every culture
Mhm.
nicely with glycolic acids. But again, you have to stay at the
Mhm.
lower percentages. And then the how often depends on your skin qualities. Like if you have eczema, you're probably only going to use it once a week. If you have maybe let's say a 10% strength, or you might be someone who can't leave it on. There are some nice overnight glycolic products, but some of those are too irritating for people with dry skin. So you might just leave it on 10 minutes instead of overnight. And then other ones that are in pads. So I would say most people can use a 5 or 10% glycolic acid safely and well. But then anything you're going to do like that, start with a day a week and then a couple days a week and see what your tolerance level is, but try not to
Mhm.
push it too fast.
Very good words of advice. So thank you for everybody who's joining in right now. We just want to go back and just say who we are. I'm Dr. Kristina Tansavatdi. I'm a double board certified facial plastic surgeon. And this is Dr. Karin Harp who's joining me, who's a board certified dermatologist in our local area here in Westlake Village, California. If you're not from this local area, you need to come see us. I'm just saying. All right. Our
Please
topic
do.
today is skincare and all things about skincare. We've had some great questions being posted already so far. If you have questions for us about skincare during this time, please post them for us so we can go ahead and answer your questions for you. So Christine posted another question. She's full of questions today. Christine says, what are
Yay.
your thoughts on hydrating paper masks? Does this cause dryness to your skin if you use it frequently?
So it depends on the mask. Christina, do you have a knowledge of like what kind of paper mask people do mean, or do they mean the ones in the packets you can get from Korea,
I
America,
know
wherever?
I've
Is that
seen
what
some of
they
them.
mean by paper?
I've had one from SkinCeuticals before that it's a bio serum type thing that when you put it on, it's really hydrating.
Yeah,
What do you think about that?
yeah.
What do you think about
So my favorite is the SkinCeuticals hydrocellulose mask. I love it. It's super hydrating, and people use it. You
Yes.
have a pooch. People use it two different ways. One is for wonderful hydration. So you unfold it, take the little cheesecloth off, put it on your
Yes.
face. It's super hydrating. The second option is to some people actually after like a treatment or if you just did a peel or something, you
Hmm.
can put it in the freezer or
Hmm.
not freezer, sorry,
Yeah.
fridge and cool it and then take it out and put it on. It's lovely. So that is my favorite. I know masks are a lot of fun and I feel like I get that question a lot. And I would tell people use things that aren't drying and irritating. The clay mask can be drying and irritating. I think hydrating ones seem lovely from what I've seen. And then I would look at your ingredient list just to be careful about
Hmm.
preservatives. So at the end of any ingredient list on any agent bottle, if you see the words parabens at the end, methyl paraben, all kinds of parabens, those are preservatives that some people are allergic to. So I would try to stay away from the paraben containing masks, but a lot of the other ones are really nice. I think I would stay with the soothing and hydrating ones. So hopefully, they're being accurate about what's in their mask. And I haven't really been seeing people with problems with those. I feel like people are doing well. The only problems I'm seeing are the clay masks and sometimes the charcoal ones. Sometimes people just suck all the moisture out of their face.
Charcoal and clay is what
That's
you're
not so
saying.
great. Charcoal and clay are the ones that people can overdo it. SkinCeuticals does have a really nice clay mask that's for acne, but it's different. It's not the unfoldable
And
type.
how about for the hydrating
on.
mask? How often can you use them, you think? Could somebody use it twice a day?
Ooh, you could if you wanted to. I mean, you could use the hydrating mask every day. There are a couple neat ones out. One is the Instant Bright by Skin Medica, which is an eye mask. It's awesome. It's a little under eye mask. It's beautiful. The other one that's not a leave on, that's a place on, is the by Epionce. It's a hydrating firming mask. So their firming mask is lovely. That works for all ages. Some people can leave it on all night. Some people leave it on. If you have rosacea, so the skin is a little bit more sensitive or a little bit breakout prone, then you might not leave it on. You might put it on for 10 or 20 minutes and then cleanse it. Pots of masks and place on masks can both have their place in our world. But I don't think you can overdo the hydrating, honestly. Like, it's really interesting.
Question for you.
Yeah.
So if somebody said, you know what, they're trying to save money and they don't have the money to pay for a lot of the masks in between, could they do something else? Like, you hear about people using cucumber, using aloe, using, different regimens that are just something that they can find and put that on their skin. What do you think about aloe?
Yeah. I think cucumber is nice. I think aloe is really nice. Some people are allergic to it, but not very many. So it's very uncommon to be allergic to aloe. I would look at my product carefully because aloe, again, will be sold as aloe, but then you look at the percentage and there's barely any aloe in the product. So look for things with a high percentage of actual aloe. I think that would be nice. And people may have bought it all right now to mix in sanitizer, but aloe is really lovely. And then the other one I'm seeing is people are using chamomile tea bags on their eyes is one I've been hearing lately. Yeah, and that's fine as long as you're not allergic. I happen to be allergic to chamomile, so putting that on my face would not be a great option for me. But chamomile has a very nice anti-inflammatory effect, so it's in all kinds of nice hydrating and natural products.
Use that for
I think that's perfectly
I get
fine.
bags, and it gets better through the day, but I haven't used it in the morning. In the morning, it gets puffy, so I might try that chamomile tea bag, huh?
Yeah, or cool, cucumber slices. Like, that's such a classic thing. If you think about like movies from the 80s or 90s, everybody's got a little cucumber. But yeah, but I think that's great.
So AC Blair asks, I have a question from a guy friend. What helps with rosacea and dry, irritated skin?
So for rosacea, one of the issues is avoiding inflammatory diets. So triggers that people can have. So people can have issues with alcohol, spicy foods, hot foods on the tongue. So if you eat hot soup or hot coffee, just let it cool down instead of having it hot, because that's a classic trigger for rosacea. Try to use products that are non-irritating. So that makes a big difference for people. Recognizing stress makes it worse. Heat makes it worse. So if you're a cook, try to keep your face out of the fire. Saunas and hot yoga are not great for rosacea. And then using things that are calming without irritation would be good. If you're a natural products person, calendula cream can be really nice. That has a nice anti-inflammatory effect. If you're a person who wants to use kind of branded over the counter, La Roche-Posay has some nice components that can be hydrating, like their Tolerane line is nice. That's a good, cleanser, moisturizer, anti-inflammatory. And then with rosacea, usually we need some spot treatment of some sort. And you have to try to get something that's not too irritating. We do have prescription strength things that we can use for rosacea that are fantastic. But there is one, I think it's by The Ordinary, that's azelaic acid. Azelaic acid is a really nice ingredient for calming rosacea that you can buy over the counter. And then if you find things aren't working, that's where it's really good to make an appointment and get your rosacea, get help with rosacea. Rosacea is a chronic long-term inflammatory condition. So it makes a big difference to people if we can help get it settled down and keep it, good for their lifetime.
And you talked about alcohol too, right? Alcohol consumption. Okay. Hi, Sheila. And then Christine just said, I love today's topic. Thanks. Yay.
Oh, thank you.
I brought such a great speaker on with us today. So I hope everybody's enjoying this.
Thank you so much.
She's just a wealth of knowledge. All right. So I have a question here I'm going to post for us. Uh, so here it says, what foods should I avoid to prevent breakouts? Which is a common question I get a lot from patients. Or sometimes they don't know that
That's a great
the
thing.
foods that they're eating are causing the breakout. So
Yeah, and I definitely find I feel like people are more and more informed about that, or open to talking about it these days, because people want a more proactive, preventative, approach to their care, which is wonderful. So things that we want to avoid. So avoid things with added sugar. So anything with added sugar is an automatic not so great for our acne. And the reason for a lot of the recommendations for acne is about glycemic index. So anything that raises your blood sugar, it raises your insulin levels, and there's something called insulin-like growth factor that makes our acne worse. So if we can avoid those sugar spikes, it makes a big difference. So avoid things with added sugar. Avoid pure carbs that are like white bread, white rice, those kinds of things. So instead of white rice, eat brown. Anything that's going to raise your blood sugar quickly is not preferable. The other question we get a lot, and then obviously eat a good portion of fruits and vegetables. So I tell people, take your plate and divide it up and go, okay, I'm going to have a good portion of fruits, good portion of vegetables, nice protein. My carbs should be small, like a quarter of the plate. If you're going to divvy it up, it's, half of the plate should be fruits and vegetables, 1/4 protein, 1/4 is carbs. If you've got half plate carbs, that's a problem. And then the other issue is dairy. People ask about dairy a lot. So dairy, the studies show that it's not an allergy. If you drink a lot of milk, like large quantities of milk, that non-fat milk actually raises your blood sugar more than milk with little fat. So you probably want 1% instead of non-fat. And the idea is the fat is keeping the sugar load down. So it's suppressing it, letting it leave your stomach a little more slowly. So you're not getting that sugar spike. So 1% milk would be great. And that's really officially for people who drink lots of milk. A lot of people also don't drink milk. Other dairy can be an issue for some people. And again, you just have to look at that in yourself. And again, it's not an allergy. And then the other piece is whey protein. So we do see a lot of athletes or people who enjoy smoothies adding whey protein. Whey protein is a dairy source, and they're not really sure if it's the dairy that's the issue or something about the whey protein, but it has some sort of pro-inflammatory effect for some people. So we say just be careful about that.
Well,
What
everything
else?
that you've said so far, I'd like to say is also important in terms of longevity. So everything you said is healthy living.
Yay.
But you said something about the insulin growth factor, which is important because for people who don't know, important on the skin, right? Because it's an inflammatory source for the skin, but it's also an inflammatory source for our body completely. So everything that you've said so far is great for anti-aging purposes too, in terms of limiting the amount of carbohydrates we take in, and also knowing the proportions of how much vegetables we have on our plate. More vegetables, less carbs. You can have some fats, but you want to have a good mix of fats. And we want to tend towards maybe like a DHEA, EPA regimen where we have our omega-3 fatty acids. So that's what I stress on my patients. I'll tell them that too.
That's fantastic. And one thing I really love about having this conversation with you, because you and I don't get to talk about this very often, is that it's really neat because it shows you how we are people who care to take care of the whole body, right? So I see it as, my job, like you said, you're a head and neck surgeon, right? So you're thinking in this zone. However, and mine is skin is everywhere, right? But however, we're both people who think about the whole body. So we recognize the mind-body connection and the fact that all of this is tied in together. So our job is to make you, to help you all achieve your goals for health overall. So I just love this. So thank you.
Our gut is tied to our skin and is tied to the rest of our body. And our mind as well, like you were talking about.
Absolutely.
And sleep. Oh, what do you think about sleep in terms of acne breakouts?
It really contributes. It's funny. If you look at studies on schools, so colleges or high schools, 95% or more of students are around test time all have breakouts. So they've done studies where you go look at every classroom right before finals and poof, everybody's got a breakout. So I try to teach people about that as far as realistic expectations, right? As we stress, we are going to break out. And obviously want to do things to help that, be minimized. But sleep, same thing. We have to sleep. We have to turn off all the bright blue lights before we go to sleep. If we're having difficulty sleeping, we need to do some things. There's a neat, Alexa has a program now on Volley FM that's like a sleep guided sleep. That's really lovely. So yeah, anything you can do to help yourself sleep or, sleep longer and sleep better, I think is a really healthy thing. And having, what's that called? Sleep hygiene, right? Yeah, I've learned not to put my medical magazines right next to my
No,
bed.
no
Not
books.
the best
There's
place.
no books in my
It's
room.
really hard to
I
turn my
leave my
brain off.
phone outside of the
Uh-huh.
room. These are all things that I do for my sleep. I try not to do
Good for
anything on an
you.
electronic device the last hour before sleep. I will read a book, a physical
Mm.
book. Those are some things that I do. And then I got these glasses. I forgot the name of the company, but they make these blue blocking glasses. And the research is kind of
Oh,
up there, but there's no harm in wearing them, so I just wear them at too. So
yeah.
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 So
Makes
AC
sense.
Bar asks the question: does the type of pillowcase makes a difference in causing wrinkles? Ooh, that's a good question.
Well, I think a couple of things. I mean, one is you want
Yeah.
breathable fabric. So I think cotton is nice if you can have it, or a higher percentage of cotton. Silk is lovely if someone has silk pillowcases. But I think cotton is better. I mean, more breathable is better so you don't sweat. I think that keeping it smooth actually does matter, and it depends on the person. Like I'm a person who swells easily. So if I'm overly hot and I've laid on my face and I have a wrinkle in my pillow, I definitely will walk into
With the
work in
wrinkle.
the morning with
Yeah.
a wrinkle on my cheek. Yeah, it takes a little bit for it to go away. But that's because I have rosacea and I swell. But I still think a smoother pillow is better, and then something breathable. And then for those people who have eczema or allergies, you really do want a dust cover on your pillow. So dust cover on the mattress, dust cover on the pillow. It'll keep
Mhm.
you healthier just to have that reduction in exposure to dust and dust mites, so you have less inflammation. It doesn't actually attribute,
Mhm.
cause wrinkles, but I think just overall health and sleep hygiene, that would
Yeah, and
be a
I
good
think a
thing.
lot of people do sleep on their sides, which I've started to notice. My facelift patients, of course, I have them sleeping straight as much as possible, and it's hard for I
Mm-hmm.
start to find out how many people out there really sleep on their belly or on their sides. And for
Mm-hmm.
me, I've always been a
Mm-hmm.
traditional sleep on my back. And I'm what they call, what's
Okay.
the term for it? But basically I'm a soldier in bed. I don't move around, which is, I guess, good. But then I have patients who ask, what should I do? Because I sleep on my side and I get this wrinkle on one side because I'm always sleeping on this one side. So
Mm-hmm.
how do I avoid it? What would your answer be to that?
Well, honestly, I mean, we actually can't control how we sleep. So we're stuck
Yeah.
with how we sleep. And we don't want someone waking up in the middle of the night in order to change how they sleep, because you need that healthy sleep. But the big thing I would tell people is sometimes people have decided that their left side is an issue because of sleeping, because that's
Mhm.
because we're all what people call meaning making machines. Like we look at ourselves and we decide something. But the left side for most, Americans, most Americans who drive are often
Mhm.
the driver, and we get that UVA coming right through that driver's side window. UVB is blocked, the rays that cause sunburn, and so we don't realize we're getting aged. And so the deeper one is going through that left window, and it's not coming through the front because that's a special kind of glass that's meant to break. But the left side UVA goes straight through, so it's very normal in our practice when we're doing skin exams to look at the left side of the face, left arm, and even left chest, and recognize, or left neck, how much sun damage there is. So brown spots, fine lines, wrinkling, reduction in fat, which I'm sure you're
Mhm.
seeing in facelifts. And then or if you were the passenger in most of your life, on the right side, it'll be right side sun damage. So we try to teach more about that
Mhm.
kind of sidedness. Because sleeping, yeah, I mean, I know they've even designed pillows for that, like, I don't know how many days someone can sleep in a special pillow to stay upright, and do they really do it? Have you ever had to do that? Like for facelifts, do you have people use
I
special
don't have them
pillows or
use
anything?
special pillows, but I have them put pillows on either side so they sleep straight.
That's
And
nice.
then, so then that's a reminder when they roll over and they hit the pillow, they're like, oh, okay, I have to sleep straight. So it's just
Yeah,
kind of
yeah,
preventing
that
them.
seems
So they
very
get one of
logical.
these wedge pillows on either side. So that helps. Um,
Yeah,
yes,
as a
but
temporary
it's
measure.
hard to get
Yeah.
them to sleep like that forever. So I just usually have them doing it for the first 2 weeks after surgery, because it's particularly true, because what they'll
Okay.
find is 4 or 6 weeks later after surgery for a facelift, if they start to go back to how they sleep, they will find that when they wake up in the morning, the side that they slept on has more swelling, and they can visibly see the difference.
Uh-huh.
Particularly because the surgery caused inflammation, right? And they're still healing, so they will notice that difference. But if you haven't had surgery, you wouldn't notice the difference. But from the surgery, you do. So you
Right.
do notice that you are getting more swelling or more drainage, lymphatics on that side because you're head down. So
Mm-hmm.
All right. AC Bar
Perfect.
asked another question. And oh, before I answer AC Bar's question, I want to thank everybody who's joined us here. And hopefully you are getting a lot of information from what we're talking about today. So hi, Sheila. Hi, Anita. Hi, the face surgeon. Hi, Lovey Ospina. And Martinez, Alvarado, Maria, Jose. Whoa, that's a mouthful. And hi, Melissa N. Macias. All right. So let's go over AC Bar's question. Another question from same guy friend. Okay, she's got a guy friend that really wants to know. Can you develop psoriasis on your scalp?
Absolutely. So scalp psoriasis is very important. It's I would say it's important just because it's uncomfortable, and if things get pink and scaly and scale falls all over the place, it can be often itchy for people. It can come down on the face. If the chunks are coming out of scale, then chunks of hair can sometimes come out too. So scalp psoriasis is considered by medicine and the insurers as very, very important. And I think equal to groin or hand and foot, because it really causes dysfunction for people. We do have a fair number of people who come in thinking they have scalp psoriasis, and sometimes it's actually what we call SIBO psoriasis, where you get really bad dandruff that's pretty dramatic. But we are always kind of looking for that. But scalp psoriasis is significant enough that if someone doesn't have psoriasis in the rest of their body, we're still teaching them about inflammation in the body. We're still teaching about increased risk of diabetes or heart disease. We're using great medicines, and it is an indication for actually systemic medicine or light therapy. So we have a laser called X-Track, which is medically covered and scientifically proven. It's wonderful, and we can actually treat the scalp with UVB light to control the psoriasis on the scalp. So there are a lot of options, but yes, can absolutely have scalp
So
psoriasis.
UVB light, how is that different from, let's say, just going out in the sun, getting some UVB rays?
Good point. Good question. So the challenge is when you go out in the sun, you're getting UVA and UVB and ozone and infrareds. You're getting a lot of exposure without control. And so in a medical setting, we have devices either that give just UVA if we need even deeper light, or UVB, narrow band UVB, or UVB by itself can be used very safely. So there's actually no increased risk of skin cancers in using the X-Track laser. The only patients we don't treat are people with a history of melanoma, because we just don't want any UV on them at all. But it's very safe. We can treat eyelids, scalps, groin. Now, unprotected light like UVA, you actually can't treat the groin. It increases the risk of skin cancer. But B is very superficial, and the dosing is very controlled. So it's a very controlled environment and treatment. But people do find psoriasis tends to get better in the summer for most people, not everyone. And we think a lot of that is from some sun exposure. So psoriasis is one of the few conditions, or vitiligo, where we say, and vitiligo is a condition where people lose color in their skin. We tell people a little bit of light is okay. It's one of the rare things where in dermatology we tell people light is okay. One of the things, just to go back to one of our earlier topics, is acne. People used to use sun lamps for acne because light calms inflammation or tanning beds. But we really don't want those things to happen, because we have the increased risk of skin cancer. And additionally, acne will flare badly after sun exposure. So you get this initial calming of inflammation, but then you get this response of the body going, wow, I did not like that. And that's where vitamin C is really important too. Vitamin C, topically super potent, especially the SkinCeuticals agents, help us calm that sunburn reaction.
So just coming from that question from AC Bar, it sounds like that guy friend has both acne and rosacea and possibly psoriasis. Is that something that you see very commonly, with the two showing up hand in hand together?
Ooh, good question. I don't know. It's not something I've thought about as far as the combination per se. So I don't have data on the number of people, but I think we see a lot of both conditions in our office. Absolutely. And there's a huge number of undiagnosed people with rosacea in particular in America. It's in the millions. So the number of people with undiagnosed rosacea is huge. So I think that's one of the important times when people have acne, or they see themselves as having acne. Often you really do need to see a dermatologist to talk about, do I have acne? Do I have rosacea? And to really go over those things, because there's a lot of crossover in what can be helpful with the agents, but there's things that are more specific to rosacea that might benefit people more.
Thank you for all your advice. So Alta Para Pharmacia, hi Bianca, hi Glam Skin Nurse. All right, so I think we're going to go back a little bit, because there were some questions about acne, and then popped up in my mind about that question, because we were talking about, sleep and how it affects acne in the people who are studying for tests right up to the test, and that how it's affected them. So question comes up, and I'm sure you get this too. What about patients who say, I've got a lot of acne popping up. Can I pick at it? Because, everyone wants to pick at their acne spots. What is the answer to that?
So, and I bet you know. So, no, it's a great question, because people either pick or they don't pick. There's actually a diagnosis of acne of young girls. It's in French, but it's a diagnosis in dermatology text. And I don't think it's fair to say girls, honestly, because anybody can pick their acne, but people pick or they don't pick. And so we try to teach people who pick, why don't you pick? So we don't want people to pick because it increases the risk of scarring. It delays healing. So we heal a lot better if we don't cause an open wound. We will have less pigmentation. So people who make color well in their skin don't appreciate pigment left over. And often people come in and think they have scars, and it's not scars, it's marks from the inflammation, whether it's a pink or a brown. Scarring is really more the indented appearance or other types of appearances, but we don't want to pick because we want to delay. We want to have faster wound healing. We want things to resolve with less markage, so pinks or browns or indentations or whites. It introduces bacteria, so we don't want to get infections. We definitely see people who have acne that they picked or acne that they over chemical peeled or over exfoliated coming in with staph infections. So we'd like to not have bacteria. And when you squish on your own spot, when we push on that hair follicle, the product in there can go out and it can go in. And when it goes in, usually you get some of each. And when it goes in, it causes more and more inflammation. So you really want an esthetician to do a nice job of cleansing things, opening the pores, doing it appropriately to get that cleared out. Hydrofacial or other, dermal infusion, microdermabrasion procedures, those kinds of things can do a really nice job of cleaning things out, but you want professional, super clean hands doing gloves. That, or Q-tips or the comedone extractors and gloves. Yes, all those lovely things. Yeah, so please try not to pick because it's a lot more work. But we have, things we help people with to help them either not pick or deal with what happened after.
I've gotten to the point where I've it's just about to come. Just pick it.
Yep. Yeah, we even do tiny Kenalog injections. So just the tiniest whiff of an anti-inflammatory, and we do those a lot, but just a tiny bit just to calm that little, numbing down so people don't get in trouble and want to destroy it.
All right. So Tweety asked, my esthetician applies alcohol to my face after waxing. She said it will help prevent breakouts. Is this okay?
So, we want to trust our esthetician, right? So they're talented, licensed people that we love and trust. So we want to trust that this person is treating you in their very best manner. So I'm not going to tell you that whatever they're doing is wrong, but maybe ask them, well, it depends how you feel afterwards. So if you feel like it's really burning, that would be a little too much inflammation. One thing they're getting you is less risk of infection, because sometimes people do actually get staph infections and things after waxing. But you could I guess my question would be, does it seem harsh afterward? Does it seem too burny? Is it, because typically alcohol is drying and irritating. So I would say I don't prefer alcohol afterward. I would prefer something a little more soothing and anti-inflammatory. Sometimes we can use a laser enzyme gel. Sometimes you could use a calendula cream. You could use clindamycin lotion. Lotion would be a lot better than a gel base. So I feel like alcohol-based things might be a little much if the skin's not gooey to start with.
Alcohol after something like that would be too drying, particularly if you have any open wounds too. But I think the reason why your esthetician might be doing that is just to make sure that the surface is clean after they've just done something that's irritating. They don't want to have a nidus for infection, so they're just alcoholing the site. But the alcohol can be drying.
I think so too.
All right. So I'm going to go back to my questions. Do you have more questions on your end that you wanted to address? You had some clients that sent you some.
Let's see. Well, I think one of the questions that was nice, and someone brought this up earlier, was retinols. So the sort of where does retinol fit into our regimen, and what are these things that start with the RET word. And so, you know, the concept of retinol versus retinoic acid or tretinoin. So these are all agents in the group of what are called retinoids, and they come from vitamin A. And so retinols are what you see over the counter, and they tend to be weak. So they're weak, they're slow to work, they're better than nothing. We like retinols a lot. So most derms and plastics, if they're not trying to be pregnant or something like that, or their skin's not too irritated, like to be on retinoids because we like to de-age ourselves. We like to reduce fine lines. It really does improve your collagen, and it reverses sun damage. So retinoids, in addition to vitamin C's, are things we kind of want everybody on if we can. Not everyone, but lots of people. So retinol will be weaker and more gentle. Prescription strength retinoids would be stronger. And even the cosmeceutical retinols or retinoids would be stronger. And you kind of want to be careful in patients who are putting themselves on something. I always tell clients, you know, start at a low percentage. Don't just go into the highest number to start with, because you're just going to dry your skin out. You want to pick something lower and start and work up to, you know, every other day, then every day. Again, for people who are not trying to be pregnant and who aren't pregnant. For people who can't, you know, tolerate retinoids, Epionce has the lytic treatment line that's really lovely, acts like a retinoid but isn't one. And I think that, you know, and some people with acne need to be on oral retinoids. So these vitamin A based things can be very, very helpful. It is not safe to take loads of vitamin A orally, so I would not recommend that. But I think using topicals really help us. And then, you know, in the old days, people thought they had to be drying and irritating. So then if it wasn't drying, they'd come and go, oh, it's not working. Like, no.
Yeah. What is that? Blanking out right now, starting with the B. Benzoyl peroxide. Oh, I was using that with my acne when I was younger. And it's like, oh. Now knowing all the information today, I'm like, what? Nobody taught me. Nobody told me any of this stuff.
We have better tools now. Exactly. And that's a lot of, you know, the doctoring that you and I do is the joy of sharing and educating with our patients, that we want people, we're not just going to throw you a prescription or say, do this, sign up, you know, come in. We really want to share and educate why to do this. And I think when we share the why and we give the expectations, people are much more likely to actually be healed through our effects, and they'll be excited, and we're in a partnership together. Like, this is, you know, Dr. Tansavatdi and I it's our job to take care of your skin and your structure and your youthfulness for your whole life. So, you know, we're thinking now and to the future. You know, our brains are like planning. You don't mind me speaking for you, but you know, I know we think like this way of like, okay, here's where we are now. How do we do this? Let's do this. You know, we're responsible for our patients forever. And so we love to do that. So there's different things that we'll recommend over time because we're thinking about you in a sense of time.
I won't get political, but this has more to do with, I was going to think about how, what has happened with the coronavirus, and if we had a crystal ball, or actually if we had made a stop and said, you know, this may affect us in the future, but people are not thinking about stopping practices or stopping just, you know, the economy in general because the fear of us going to recession, but what can transpire down the road. And we can't go backwards, but knowing what we know now, I mean, with the information we did, if this ever comes up again, we need to be faster on the ball on what we've done with the economy. So that was my political spiel. Anyways, question here from Christine asks, what are your thoughts on micellar water?
Micellar water is lovely. I mean, I think you know, micellar water is water with oil droplets in it. I mean, that's what it is. And so I think it's nice. It's a nice way to cleanse without putting too much oil into your skin. It's a great way to take eye makeup off without a lot of chemicals. So I think one thing it helps us with is a soothing way to remove makeup or cleanse things without chemicals. So I think that's perfectly nice. Again, I would still look at, there shouldn't be a bunch of preservatives. There's no reason to. Make sure you shake it up. So you want to mix it and have that nice little emulsion that you're going to use. I really think it's nice around the eyes as long as you don't tend to clog. I wouldn't make my own, you know. I think sometimes people get into some things where they're making their own and can grow bacteria in some of those bottles, and we don't love that. But I think it's perfectly nice.
I don't have enough information on micellar water, so I'm going by what your advice is.
It's perfectly fine. I think those are nice in the night. And I think, the one thing I guess that brings up for me the question of oils. So that's controversial. A lot of people love to put oil on their skin.
Yes.
And dermatologists don't
Yeah.
really love it. We just don't. And it's not because I believe or don't believe. It's really based on studies and science and how our skin functions. And so we want things that hydrate from the inside. We want to heal the outer layer of our skin. We don't want it to be highly functional. Layering things just on top of it isn't great. So but there's some things that are nice, like coconut oil can be nice for some people, can be soothing for the scalp,
What about
can
olive
have some
oil?
nice effects. But there's olive oil can be lovely. And some of the studies in olive oil in some conditions can be nice. Some, the pH isn't quite right. And so it can change that. Our skin is actually acidic. So if you throw the pH and make it too neutral, you can actually cause more trouble. And so it's interesting. Just I think when you look in the world and if something is marketed as here's this agent and it's perfect for everything and everyone should be on it, there's something wrong. And so for coconut oil, I feel like there's been this period where somebody must be growing a lot of coconuts and wanting to sell a lot of
Yes.
it. So there's too much, but some is okay. If you like to get out of a shower and hydrate up with some coconut oil or olive oil, or if you're a
Oh, yes, I've
castor
heard
oil
about
person
castor
or
oil too.
whatever,
Yeah.
those are perfect. Yeah, it's perfectly nice and you're not going to hurt yourself as long as you're not allergic. It's not clogging your pores. Acne prone skin doesn't usually love oil. But again, I also would say don't go look for everything that says oil free. Just because it's oil free doesn't mean it's great for you. That's not actually a term dermatologists are looking for either.
Mm-hmm.
So, nothing is perfect for everyone, and trying to get to know your skin and work with somebody on that is ideal.
Yay, such great advice today from you, Dr. Harp. I hope everybody's enjoyed this. I know we've been going a long time, and uh, so we're gonna probably stop it here. And I would love to bring you back again, Dr. Harp, if you'd be open to doing so.
Oh,
We'll have to find
I'd
another
love it.
time, but I think we should have a regularly scheduled, maybe every other week or so, or every week, once a week, we should go over just skincare tips because I think everybody loved today. Look, there we go. Christina's saying thanks for advice today. She really loved that. And she says she uses
You're
micellar water
welcome.
to remove eye makeup and it's nice. So if it works for her, that's
Yes,
great.
and that's
All right,
perfect.
so a little bit before we end, I want to tell you the topic for tomorrow. We go live. I wanted to let you know this is Dr. Kristina Tansavatdi. I go live on my channel every day at 3 o'clock in the afternoon. This is just weekdays. Sorry, I'm closed for business on Saturday and Sunday, but it is Monday to Friday at 3 o'clock in the afternoon. And we'd love to bring Dr. Karin Harp again for our next skincare tip session. And I know everybody loved it so much. So Dr. Hart, what would you like to leave as a lasting advice for everybody? And then tell a little bit about yourself and where they can find you.
So thank you so much. So I'm Dr. Karin Harp. I'm a board certified dermatologist. I've been an MD for 18 years and practiced for 15 as a dermatologist. You can find me at Apex Derm. So follow me on Instagram, please. And our website is apex-dermatology.com. I'm the founder and medical director of Apex Dermatology in Westlake Village, California, where we love providing world-class care and loving our patients and taking great care of them. We really appreciate fantastic colleagues and community connection with Dr. Tansavatdi and our peers in the community. We have patients who come from all over the world, so we're really grateful that people come to Westlake to see us. We welcome you at any time. And we even do video consultations and now telehealth we can only do for California residents, so permanent California residents, but we can always see you in person if you're in town. And then you can find us our store at apex.dermatology.myshopify.com, or you can use a old-fashioned telephone and call us at 818-889-2739. Thank you so much, Dr.
No
Tansavatdi,
problem.
for including
And
me.
then
It
so
was a real treat.
tomorrow, our 3 o'clock afternoon tomorrow, we're bringing back Dr. Rob Jr. that I had last week on Thursday. We're going to go on everything about the coronavirus. And I guess he's put a little video on his site where it's going to be a little war between the two of us. I don't know if you guys are going to be interested in that, but I think he wants to go at war now. I don't know. Anyways, a little bit about me, Dr. Kristina Tansavatdi. I'm a double board certified facial plastic surgeon in Westlake Village, California. And I love my colleagues. I love Dr. Karin Harp. Please go see her if you're in the area and you need to get advice on skincare. She is the bomb. And you can find me at my Instagram at Faces by DRT. I also have a Facebook channel, a YouTube channel at Faces by DRT1, and my website, facesbydrt.com. I also do have an online skincare store, and that is facesbydrt.com. shop.myshopify.com. So I have a Shopify store as well. And I do have my own brand line. I don't have any particular recommendations. You'll have to just schedule a consultation in order to get some information on that. But I would love to see you in person too, either through or in our office when we open, or through our virtual consultation. You can book that on our website at www.facesbydrt.com. All right. I'm going to do it now.
May I add one more thing, Dr. T? Just to share, so our office right now, we're doing telehealth. And so besides skincare, we do medical dermatology, surgical dermatology, and cosmetics, so all the above. But telemedicine, we're open for, eczema, psoriasis, rashes, anything we can help you with that we can do by telehealth. I actually had somebody, I had to sew up a laceration that happened in the middle of the night last night. So if somebody has some urgent thing that we can help them with, or where we can keep them out of the ER or urgent care and they're a patient, we're very happy to help. So we're doing urgent in person only if it's truly, life-saving urgent. And in telehealth, we can see you virtually just like this.
Yay.
So we'd sure love to see you.
All right. It was great seeing
Thank you.
I'll
Bye.
see you. Bye-bye.
Nice to see you.